Welcome. How are you doing today, folks? Welcome to the Dr. Khan Show. Today we are diving into the world of diabetes management, specifically the hemoglobin A1c test. Is it the ultimate in blood sugar testing? Is it the crystal ball predicting your diabetes future, or is it just a bunch of hocus pocus? We will go over today what the heck is hemoglobin A1c? Why should you care at all, right? The numbers game, what numbers should you keep in mind? Then how is it different from your regular 3 times a day, 4 times a day, your regular glucose testing? And then last but not the least, the best tips for lowering your hemoglobin A1c levels. Let's talk about this now. All right, so what the heck is hemoglobin A1c? First off, hemoglobin A1c actually sounds like a Star Wars droid, but it is actually a measure of your average blood sugar levels over a period of 2 to 3 months. It is basically a test telling you that have you been following your doctor's orders over the past 2 to 3 months. It is like your blood sugar report card, and it shows actually how much sugar is actually sticking to your red blood cells. And if your hemoglobin A1c level is high, think of it as your blood's way of saying, hey, lay off those donuts, will ya? But then why should you care about this? Why is it so important? Well, a high hemoglobin A1c means that your blood sugars have been on a roller coaster, and it's not the fun type of roller coaster. We're talking about increased risk of heart disease, kidney disease, and eventually something we call that you develop neuropathy, where you don't feel your toes, and then a rat comes around and chews on your toes, and you don't even realize it that the rat is biting off your toes. And sometimes the neuropathy can give you pains and pins and needles, as if a needle is poking your feet over and over again, non-stop. That's not good. So unless, my friend, you are a frequent flyer to your nearest hospital, then you would want to keep that A1c in check, and this is going to be crucial. Basically, because it tracks your treatment effectiveness, it helps your doctor determine if your current diabetes management and plan is working, if your dietary habit is good. No need to fast. Unlike other blood sugar tests, you don't have to fast the night before you take this test. Now, isn't that sweet? Then, my friends, the numbers. What are the numbers saying, right? Let's talk numbers, my friends. So an A1c below 5.7 is considered normal. Now, between 5.7 and 6.4%, this is called the pre-diabetes territory. And 6.5 or higher, then you, my friends, are in diabetes land. You have taken residence in diabetesville. Remember, folks, it's like golf. The lower your score is, the better you're doing. All right, now who should get an A1c test? It's like in Oprah.
You get a prize. You get a prize. You get a prize, right?
You get a prize, you get an A1c test if you have, of course, diabetes type 1 or diabetes type 2. It's to check your blood glucose levels management. And then before you get your diabetes is to test people who are at risk. You have a family history of diabetes, or you're overweight and obese, and you like to munch on a few pizzas and french fries and McDonald's every now and then, right? And then, of course, people who have pre-diabetes, we already know that you have a problem and you could be developing diabetes. So we like to know what your A1c level is. And the American Diabetes Association, the ADA, anyways, recommends that people with diabetes get their hemoglobin A1c checked at least twice a year, or more often if they actually need a much stronger and stricter control and drugs are being adjusted more frequently. All right, now the good, the bad, and the limitations of the diabetes A1c test. Now, hemoglobin A1c is great because it gives you a big picture, a huge, wide picture of your blood sugar control, but it's not without its flaws. Certain conditions like anemia or kidney disease or pregnancy can actually skew these results. Anyways, the bottom line is it's a useful tool, but not the whole toolbox.
Oh, good God. Why can't anything be simple?
Now, how can you lower your A1c levels? So, diet number one, of course, focus on real foods, okay? Add fiber, low glycemic index foods, and eat lots of protein, healthy fat. Then exercise at least 30 minutes of moderate activity most days of the week. Then medication, take them as prescribed. Don't you be missing out on your pills. And any changes you're making in your diet and your lifestyle, let your doctors know so they can adjust your medication properly. And then consistency, as we talked about, that you have to monitor your sugar levels. If you have a continuous glucose monitoring device that a lot of people are having, then get that. And of course, consistency, and it's a marathon, my friends. But my friends, this is not enough. If you really want to control your diabetes and lower your hemoglobin A1c, check out this video where I show the 7 best ways to beat diabetes within a week. Yes, you could really beat diabetes within a week. I will see you over there in this video. Thank you.